Hi, guys. It's Nurse Katrina, and I want to talk to you guys about the phrase, you don't understand the concept. So, I know you guys hear this a lot in nursing school. So, I want to explain it to you so you'll understand what your instructor means, what your professor means when she says, you don't understand the concept. So, I'll use my congestive heart failure study guide to help you. So, congestive heart failure. To understand the entire concept of congestive heart failure, you have to understand that it is a system disorder. What causes it? Many things can cause congestive heart failure. I'll say cardiomyopathy. Signs and symptoms. It depends on if it's right-sided heart failure or left-sided heart failure. It may be dependent edema, pulmonary edema. Lab values, BNP. Complications could be cardiogenic shock. Interventions, daily weights. As a nurse, I'm going to make sure that this patient has daily weights. What are some of the side effects of the medications that we give the patient? The medication that I know that we give most often for congestive heart failure is digoxin. Side effects, irregular pulse, decreased appetite. Adverse effects, digoxin toxicity. Patient teachings, if the patient starts to have vomiting, diarrhea, loss of appetite, seeing green and yellow spots, they need to stop that medication. How do we prepare this med? It's PO, but one thing that we must do, and we have to teach the patient, apical pulse. Anything less than 60 beats per minute, do not administer the medication. Do not take the medication if the apical pulse is less than 60 beats per minute. Diagnostic procedure, echocardiogram. Why? Because this will let me know the ejection fraction. Before, the patient does not have to be MPO for echocardiogram. During, the patient will lay on his or her left side. After, the patient will go home. It's a 15-minute procedure. Or the patient will go back to the floor. Teach the patient this. I will teach the patient that the gel is going to be cold and you have to be on your left side because of the ultrasound gel is cold. Nursing skills, daily weights. Why should I do a daily weights? Because anything over 2 pounds in a day or 5 pounds in a week is a complication. Before I do the daily weights, I'll ensure that I have the patient the same scale, same time, same gown, or the same material. During, make sure that the patient understands the reason for the weights. After, make sure the patient knows that you're going to weigh him again tomorrow. Teach the patient this. Weight gain of more than 2 pounds in a day or 5 pounds in a week, please call the healthcare provider. Please let someone know. Then I draw a picture of congestive heart failure. And then I make an NCLEX style question on congestive heart failure. And then I move on. This isn't 100%, but this is what you have to do to understand the concept of any system disorder. You have to know the medication. You have to know the diagnostic procedure. You have to know the nursing skill. You even have to know the therapeutic procedure. So, like and subscribe to my channel. I do very short tutorials. Leave a comment and let me know if you need anything else.